All right, so let's get started. I'm Jenny Stang, Caregiver Outreach Specialist here at Alabama Lifespan Respite. Most of you, I think I've seen before, and for those new ones, welcome, welcome, welcome. I do want to say that this is a topic that is near and dear to my heart, suicide prevention. In my life before Alabama Respite, I was a suicide prevention educator for the school system, talking with 8th graders through 10th graders about depression and suicide risk. And so this is a topic that has touched me personally as an individual and also in my family. And I know it's incredibly prevalent. Some of you may not know how prevalent it is. So I hope to shed a little light on that today. My goal here is to destigmatize our collective sorrow because we're all human and we all experience times where things are a little heavy and they're hard to cope. And so I think the more we talk about it, the less afraid we are of the topic and the more open we are to getting help. And so on that note, I hope everyone has a pen and paper available, because at the end of this presentation, I'm going to be giving you a lot of resources. So a lot of phone numbers to jot down, some email address, not email, but websites to jot down so that you can do a little digging. And if you are experiencing any of these symptoms that we talk about, or if your loved one that you're caring for is, you guys have maybe a direction of where to go to find help, because we can teach you all we want, right? But if we don't give you the tools to move forward, then what's the point? So that's the goal for today. And I also want to say briefly, all of our education is recorded and it is posted live or posted on our website for rewatch. So if you guys want to go back and watch it again, if you maybe missed something or you just want to hear the information another time, it will be available on our website. But at the end of my presentation, I'm going to stop recording and I'm going to stick around for any questions or comments, being that this is a sensitive topic. I don't think it's appropriate to record any possibly sensitive conversations, but I do want to make myself available. So if you have something specific you want to talk about at the end of the presentation and you don't want it recorded, rest assured I won't record that. It will just be a conversation between those of us here and not blasted to the internet for everybody to watch. Okay, so I'll go ahead and share my screen and get my presentation started. And again, for those of you just joining who maybe have not already put their email address in the chat, please do so for attendance purposes. All right, there we go. So suicide prevention for caregivers. I really hope that this information is useful. Of course, my dearest hope is that you never experience depression and that you never experience thoughts of suicide, or that somebody in your life never experiences this. But because of my education and because of my experiences, I know that the likelihood of that is pretty slim. Suicide affects all of us in some way, shape, or form, either directly or indirectly. And so even if you as an individual are not currently experiencing any of these symptoms, or this is not your reality right now, it may be the reality of someone you know and care about, or it may come down the pipeline later on. And so I hope that this can be helpful to you if and when this strikes your timeline, okay? So the agenda for today is we're going to talk about caregiver-specific depression statistics. There was a lot of research done after the pandemic on caregiver stress and caregiver burnout, caregiver depression. And so a lot of the statistics I'm going to go over today are born out of those research endeavors to find out what's going on. You know, when the world shut down and caregivers lost a lot of their supports, mental health issues skyrocketed, right? And so there's a lot of research done in that avenue. And so most of my statistics are post-pandemic or pandemic specific. But because the pandemic had such a huge impact on everybody, we're still dealing with the aftermath of that. There's still a lot of mental health crisis happening because of COVID worsening the situation in the caregiver's home, whether it's with the caregiver's depression or the care recipient's depression. There are still some lingering effects that are happening. And so I feel like the statistics are still very relevant. Then we're going to talk about symptoms of depression. Some of them will be pretty obvious. Some of them may surprise you. Special caregiver concerns. We're going to go through a couple of different caregiver categories and highlight some special concerns for each group. Then we're going to discuss a whole health approach to combating depression and suicide ideation. And then finally, I'm going to give you a bunch of supports and some resources that'll help get you on your way to finding help if you are so inclined to do so. Okay, so let's dive right in. Caregiver depression statistics. So there's an estimated 47.9 million adults in the United States that provide informal care to an adult with physical or mental health needs. That's over 19% of the population. So right off the bat, you know, you are not alone in this situation, right? So this is unpaid work, which includes everything from trips to the doctor to feeding, bathing, toileting, and all of this has been valued at $470 billion a year. That's equivalent to 3/4 of the entire budget of Medicaid. Okay, so you all are really taken on quite the endeavor, and you're really, I mean, honestly, our countries should really be thanking you for all the work that you do, because it's a huge undertaking. And so even in the best of times, the vast majority of this work is invisible and under-supported, and it's leaving millions of caregivers struggling in silence, okay? So some caregivers bounced back from the mental health challenges as their supports returned after the pandemic, but some of you didn't. Some of you will likely continue to struggle with that stress and worry, especially if the pandemic worsened the physical, cognitive, or emotional health of the person you're caring for. So again, some of these are still very lingering effects of that pandemic. The mental health of caregivers can also have a serious effect on the people that they look after. So researchers have found out that over the years, conditions such as depression can lead to lower quality of care. Okay, so I've probably said it a million times and I'll say it a million times more, caring for yourself is caring for your loved one. It really is, okay? So a recent study in China, is just an example, discovered that stroke patients were more likely to die within 6 months of a discharge from the hospital if their family caregiver was experiencing anxiety or depression, okay? So caring for yourself is caring for your loved one. So let's go ahead and get into the statistics. So a conservative estimate reports that 20% of family caregivers suffer from depression. That's twice the rate of the general population. Okay, so you're not alone if this is something you're experiencing. California's caregiver resource centers reported nearly 60% of their caregivers were showing clinical signs of depression. Nearly 31% of unpaid family caregivers reported seriously considering suicide in the preceding 30 days, compared to only 11% of other adults who are not caregivers. I hope you're starting to see the impact here. Nearly 40% reported having passive suicidal thoughts, saying things like, oh, I wish I went to sleep and I didn't wake up, okay? 72% of people say they feel alone as an unpaid caregiver and say they have high emotional stress, right? Preaching to the choir here, I'm sure. 2/3 of unpaid caregivers said that they experienced mental health challenges, such as symptoms of anxiety, depression, or suicidal thoughts. And you compare that to only 1/3 of people with no caregiving responsibilities that are reporting the same symptoms. And people who are caring for both children under 18 and adults, so the sandwich generation, they're faring the worst. 85% of the people in this group are experiencing adverse mental health symptoms. So that's almost everybody, right? 30%, over 30%, had seriously considered taking their own lives. That is 5 times the number of non-caregivers. 41% of former caregivers of a spouse with Alzheimer's disease or dementia experienced mild to severe depression up to 3 years after their spouses have died. So I don't want to use the word encouraged, but I hope that you can see how this is very prevalent amongst caregivers, amongst your peers. So I want to pull the shame out of this because you're not alone. If you're experiencing depression, if you're experiencing anxiety, if you're experiencing hopelessness, you are not alone. There are resources, there is help, there is support, okay? It's not just you wading the water by yourself, okay? So let's go ahead and take the shame out of this, please, because it's going to save lives, literally. So symptoms of depression. So people experience depression in different ways. A lot of times people think of the classic symptoms of being sad or hopeless, and that That's very common. In fact, hopelessness is the #1 descriptive word that people who have survived a suicide attempt say that they felt. And that's that feeling of their situation's never going to change. It's always going to be this way. It's always going to hurt. I'm always going to feel this pain. Okay, that idea that nothing is ever going to get better. That's a very common and prevalent descriptor that people use. But sometimes depression symptoms will sneak up on you. There's a subtlety to some of these symptoms that maybe, you could slip into depression and not even realize that's where you are. So please pay attention to these symptoms. And if you've experienced any of them for 2 weeks or longer, it may be an indicator that you are experiencing a depressive episode. So feeling sad, tearful, empty, hopeless, changing in your eating habits. So maybe you're eating more than normal, maybe you're not eating enough. Okay, we're looking for changes in behavior from what's normal for you. Okay, I know some people, they stress eat, some people stress starve. Okay, so losing weight or gaining weight can be a symptom of depression. Changing in your sleep patterns, sleeping too much or not enough. I personally, if I am depressed or if I'm in a low spot, I get insomnia really bad. And so I'm not sleeping enough, which of course makes things worse. But so that's how it manifests in me. Sometimes people are depressed and they can't get out of bed. They just want to lay in bed all day. Okay. Both can be symptoms of depression. Feeling tired all the time, difficulty being motivated to do anything. Okay. Sometimes you slip into these patterns and you think, well, this is just who I am now. I'm just always tired. I'm just, I don't want to have the energy to do anything, or I don't have the time to do anything, right? But that might not necessarily be just, oh, I just need to get more sleep. That could be a sign of depression. Losing interest in people or activities that once brought you pleasure. Okay, so if you used to enjoy going to Bible study, but now you can't seem to get yourself out of bed to do it. If you used to enjoy crocheting, or if you used to enjoy fishing, or you used to enjoy getting together with your friends, and now you just don't really have the juice to do it. You're just not interested anymore. That could be a sign of depression. Feeling numb, right? Sometimes you just become very apathetic towards things and towards people. Becoming easily agitated or angered. Anger does show up as a depression sign in a lot of people, especially men who feel that that's the only emotion they're allowed to express is anger. So sometimes their sadness comes out as anger. Excessive time on the internet, yikes, guilty, right? I had to delete so much social media off my phone because it's just such a time suck. And we do get sucked into those. It doesn't necessarily mean we're depressed, but we can also use that as a way to disassociate, to distract ourselves. And so if you find you're spending more time online than you are in the real world, just make a note of that. That could be a sign that you're trying to cope in a way that's easy, okay? Trouble focusing, thinking, or planning as if your head is filled with a fog. So we have that depression brain fog, not frog, fog. That's a sign, that's a warning sign. Again, 2 weeks or longer if you've been in these spaces for 2 weeks or longer. Neglecting your physical well-being and appearance. Now I know not everybody's going to have the time to, do their hair, do their makeup, shave, shower, whatever. That's okay. We get to those spaces. But if you are just experiencing this for longer than 2 weeks, where you just can't be bothered to take care of yourself, you can't be bothered to eat, you can't be bothered to shower, brush your teeth, change your clothes, okay, that could be a sign of depression. Thoughts of running away or escaping from the situation. Thoughts of death or suicide, ideas of how to end your life, okay, that can be kind of scary. I mean, not everybody who is suicidal has an active plan. Some of these might just be kind of passive thoughts, and you think, oh, well, I'm not really going to do that. I'm not really going to, I'm not going to commit suicide. It just kind of popped in my head and now it's gone. That could be the case, but oftentimes people don't have those type of fantasies unless they're experiencing a lot of stress and a lot of sadness. So just make a mental note of that. If those passing thoughts have come into your mind, just take a note of that. Here's one: ongoing physical symptoms that don't respond to treatment, like headaches, digestive disorders, chronic neck and back pain. Okay, your body will tell you when things aren't right, even if your brain is fighting as hard as it can to stuff it down. Okay, so you might not think you're depressed, but your body is definitely telling you a different story. Feeling that nothing you do is good enough. Okay, that can kind of tie into being hopeless. Like, I'm doing all I can and it's not enough. It's an uphill climb. And an increase in alcohol or drug consumption. Now, we do have those times where, unwinding with a glass of wine or a beer or something like that, it's not a big deal. It doesn't bother anybody. It's not bothering you. It's not an unhealthy habit. But if it's increasing to where you don't feel right, or you don't feel normal, or you don't feel calm and settled unless you take the drugs or the alcohol, that could be a warning sign of depression. Okay. So let's move into some special caregiver concerns. So if you are a caregiver for someone who has dementia or Alzheimer's, there are different, it's a little different for you than it is for other caregivers. So it can be all consuming. Research has found that a person who provides care for someone with dementia is twice as likely to suffer from depression than a person providing care for someone without dementia. So not only do caregivers spend significantly more hours a week providing care, they report more employment problems, personal stress, mental and physical health problems, lack of sleep, less time to do the things that you enjoy, less time to spend with other family members, and more family conflict than non-dementia caregivers. As stressful as the deterioration of a loved one's mental health and physical abilities may be for the caregiver, dealing with dementia-related behavior is an even bigger contributor to developing depression. Dementia-related symptoms such as wandering, agitation, hoarding, embarrassing conduct, and resistance or non-cooperation can make every day challenging and can make it harder for a caregiver to get rest or help in providing care. So the more severe the case of dementia, the more likely the caregiver is to experience depression. So it is very critical for caregivers, especially in these situations, to receive consistent and dependable support and respite. And I hope that those of you here today are taking full advantage of the respite program we have, and getting those breaks while you can, because it is not an easy job that you do. Next, women. So women experience depression at higher rates than men. And they're primarily women and wives and daughters are providing the majority of caregiving across the nation. In the United States, approximately 12 million women experience clinical depression each year at approximately twice the rate of men. And so depression isn't really all in your head. Sometimes people think, well, I'll just snap out of it. It's just, I just need to get over things. I need to shake it off. But there are physical factors that contribute to an increase of depression in women. So some of those factors are menopause, childbirth, PMS, thyroid disease, nutritional deficiencies in iron, vitamin D, and omega-3 fatty acids all cause depression. So if you're feeling down, if you're feeling low, if you're having a hard time kind of shaking off your sadness, it's not all in your head. Okay, maybe get some vitamins, and it's not going to fix everything, but lacking the vitamin D and those omega-3 fatty acids and iron, that can actually cause depression. Okay, so it might not fix what's going on, but it can definitely help. So a Mental Health America study found that many women don't seek treatment for depression because they're embarrassed or they're in denial about being depressed. 41% of women surveyed cited embarrassment or shame as barriers to treatment. So doctors have heard it all, right? So it's important for both your mental health and your physical health to go and get a complete physical exam regularly, and take time during that exam to bring up the subject of depression if you suspect you're experiencing those symptoms. Don't be embarrassed, okay? I hope you guys are seeing that this is a prevalent issue. You are not the only one going into your doctor's office saying, I think I have depression, okay? I would venture to say that's probably one of the number one things that doctors hear and treat when they have a patient in front of them, is about their anxiety, their stress, and their depression. So if you are experiencing those symptoms, you are having a difficult time getting back to where you feel you need to be mentally, it is not going to shock your doctor if you ask for help or assistance. Okay, that goes for men and women. Speaking of men who are caregivers deal with depression a little differently. They're less likely to admit to depression, and doctors are less likely to diagnose depression in men. And I think personally, it's because men are less likely to say something to their doctors, right? Doctors aren't mind readers. So if you say you're doing okay, they're going to think, well, he's doing okay, right? Men are often more likely to self-treat their depressive symptoms of anger and irritability or feeling powerless with alcohol or overwork. Okay, sometimes it's easy to throw yourself into your work and get distracted, right? You feel like you're doing something, you're working towards something. And there's nothing wrong with that. You know, I think we all kind of have to put our nose to the grind sometimes. But don't do it as a coping mechanism. Don't do it as a way to treat, quote unquote, your depression, okay? Because when work is done, you clock out and you're home and the lights are off and you're trying to sleep, it's still gonna be there, right? Male caregivers tend to be more willing than female caregivers to hire outside help for assistance with home care duties, but they tend to have fewer friends to confide in or positive activities to engage in outside the home. The mistaken assumption that depressive symptoms are a sign of weakness can make it especially difficult for men to seek help. Again, this is not a weakness. This is nothing to be ashamed of. It is part of the human condition, okay? And it is becoming increasingly more difficult, I think, in this society to be happy-go-lucky and upbeat, okay? So we have barriers to our mental health all over the place. You're not alone experiencing these feelings. It is very common. Special concerns for military caregivers. If you are taking care of a veteran or a military personnel, it can be a little difficult for you as well, right? There's different special concerns in this population than there are in others. So military and veteran caregivers are at risk of depression. They experience depression nearly twice the rate of non-military caregivers. The more severe the mental or physical health conditions of the veteran, the more demands that you're going to face as a caregiver. So there's conditions like dementia or traumatic brain injury and post-traumatic stress disorder that are particularly challenging for caregivers. So trying to cope with daily life and also watching out for the veterans' triggers, helping them cope with their own stress can definitely lead you to feel overwhelmed and increase your feelings of depression, particularly feelings of helplessness and hopelessness, okay? It can be all-consuming. And as a military caregiver, you might not have other people in your life understand that experience. Caring for a service member is different, particularly if you have younger caregivers whose peers are unlikely to be facing the same kind of challenges. Maybe you even moved somewhere to have better access to VA benefits, or maybe a region that's more supportive to your veterans' needs. And that can make you feel even more isolated and less likely to have help from people that you know and trust. But that doesn't mean the help isn't available, right? So the first step is to talk to your doctor, who can refer you to a mental health professional and prescribe medications as appropriate, okay? Again, there's no shame in asking for help. So, excuse me. What do you do if you think you or your care recipient have depression, right? Because it could be one of you, it could be both of you, right? It deserves to be treated with the same attention as any other illness. So if you have diabetes or high blood pressure, you're going to go to the doctor, right? So the best way to figure out what is causing the symptoms is to talk to a qualified professional like your doctor. If you feel uncomfortable using the term depression, you can say, I'm feeling blue or I'm feeling down. And describe your personal experience and symptoms. The more specific you can be, the better your doctor can help you. But it's important to make it a priority during your appointment, and to be as honest as possible so that your doctor can help you, okay? A lot of times, and this has been my experience, if you tell your doctor you're feeling suicidal, people are afraid they're going to be admitted into the emergency room, or they're going to have to go and stay at the hospital for a couple of days. That does happen, okay? But it doesn't always happen. And if it does happen, it's not something to be afraid of, okay? It's just a step in the process towards getting better, okay? So we don't want to fear the treatments. There's not, no one's gonna like lock you up and throw you in a basement, or keep you in a catatonic state or whatever. That's, we don't do that anymore. So don't be afraid to bring this up to your doctor. So it's not uncommon for a person receiving care to suffer from undiagnosed depression, right? Your loved one might be feeling it too. Everything can feel worse than it is from their perspective, adding to any daily caregiving challenges you might be experiencing, right? So if they're depressed and you're depressed, that's just a cocktail for disaster if no one's getting help. So if you suspect this is the case in your caregiving situation, you can find an opportunity to share your concern with them. Say, honey, I've noticed A, B, and C, right? I've noticed you're not as upbeat as you used to be. I noticed that you're sleeping a little bit more. I've noticed you're not getting enough sleep. Okay, you can say those things. If they're reluctant to talk about it with you, maybe you can encourage a trusted friend to talk with them, or maybe leave a message with their doctor telling them about your concerns before their next appointment, okay? So how is depression treated? Well, the first step to getting the best treatment for depression is to meet with a mental health professional. So that could be a psychologist, a social worker, or a licensed therapist. At the same time, schedule a physical exam with your doctor, okay? Certain medications, as well as some medical conditions like viral infections, can cause the same symptoms as depression and should be evaluated by a physician, okay? So depression can be a side effect to something that you're already being treated for. So it's good to ask your doctor and make sure that you rule all of that out before you get treatment. So the exam should include lab tests and an interview that tests for mental status to determine if speech, memory, or thought patterns have been affected. Although a physician might prescribe antidepressant medication alone is not the most effective treatment for depression. Okay, there is no magic pill to cure you. Concurrent guidance with a mental health professional is strongly recommended. A therapist or a counselor should listen to your concerns, screen you for symptoms of depression, and assist you in developing ways to address your stress and build new coping patterns. Okay, so it's a both and, medication and therapy, medication and coping strategies. Okay, one way to find a professional is maybe ask a friend if they have a name of someone that they know and trust. You could also maybe ask your minister or your rabbi or your doctor, or if you're employed, you might check with your employee's health insurance provider list and see if there's any doctors in network that they're covered with your insurance. There's also national organizations that can provide contact information for mental health professionals in your community, and I'll give you some of those resources at the end. And it's important to trust and feel comfortable with the professional you see. Okay, so you don't have to just call a random person and that's who you're stuck with, okay? It's not uncommon for you to request like a free introductory phone or in-person meeting to help determine if that professional is the right match for you and your particular needs and your style. Okay, you can have an incredibly qualified and skilled mental health professional that just your personalities don't click, right? That's okay. We're all human beings and we're all going to be different, and we're all going to want different things. And so, it's okay to shop around, so to speak. So when you do decide to meet with a mental health professional, some things that you can clarify would be, how much does it cost? How much is your insurance going to pay? How many sessions should I expect to have with you? And any treatment should be evaluated regularly to ensure that it continues to help you improve your health and growth, okay? So once you start getting into this, you'll realize that it's not a one-size-fits-all. It's not a blanket treatment, okay? There's going to be some trial and error. Please do not get discouraged, okay? Again, like I said, we are all different people and we all have different needs. And so your doctor may want to try something with you and it might not work right away. That's okay. That doesn't mean that you're beyond help. It just means you have to find the right flavor of help for you. So some treatment options. Upon review of a physical and mental health evaluation, a course of treatment may be recommended. So primarily people will, the options will be like psychotherapy, which can also be called mental health or talk therapy, and antidepressant medication. So they can be used alone or in combination with one another. The most frequent treatment for depressive symptoms that have progressed beyond the mild stage is antidepressant medication, which provides relatively quick symptom relief. Critical to treatment for depression is the concurrent use of psychotherapy along with medication, okay? So if you are in it, if you are in that trench of depression, please do not think a magic pill is all that you need, okay? You definitely need that help from a mental health provider to help you learn strategies to cope. Discussing your situation with the therapist can open up new self-awareness for addressing a particular emotional concern and provide guidance to address challenges in getting and staying healthy. Okay. Sometimes the causes of depression can be sneaky, right? You know, maybe you don't know what they are until you start talking to somebody, talking through and finding the root of these issues. And then you realize, aha, right, this is what I need to work on. This is what my body's trying to tell me. Okay. And when you choose a therapist, be sure to ask them about their experience working with family caregivers and how they understand caregiving related stressors. Okay. If you are participating in our Caregiver Wellness Initiative, we do have a list of therapists who are knowledgeable about caregiver issues. And so they're not going to need a primer before they meet you. Okay. So that's, if you're interested in that, please let me know and I can get you on the waiting list for that. And if they recommend drug therapy, a certain amount of trial and error is necessary to find the right type of dosage and medication for each individual. And it might take several weeks before the effects are felt. Okay, I mentioned that earlier. That's why it's really important to have good communication between your doctor and yourself. And older adults should be especially careful to watch for medication side effects caused from too high of a dose or interactions with other medications. Okay, a lot of times people get into the therapist's office, they maybe get a diagnosis and then they get a medication and then they think, okay, that's all I need to do. No, okay, you have to be very conversational with your doctor, very open and honest with your doctor, and let them know when things aren't working and they aren't helping so they can find you. There's a myriad of different treatment options available. So the first one might not work. I want to keep pressing that upon you so that you don't get discouraged. If this is the route you go, it might take a little bit, and that's okay. So there are also complementary and alternative therapies. Okay. They're promoted for coping with depression for a reason. It's kind of a the whole health thing I was talking about earlier. There's more pieces to the puzzle. Okay, so a lot of these have been tested in scientific and clinical trials. Some of them haven't. You know, sometimes people say, well, all you need is like an herbal drink, or all you need is a vitamin. Okay, that could help, but that's not going to be all you need. Okay, so make sure you're having doctor recommended therapies that can help you. So an overview of some of the common therapies are physical exercise. So exercise has been found to reduce the effects of depression. Your body loves to move, absolutely. Walking 3 times a week for 30 to 45 minutes has been linked to reducing or alleviating symptoms of depression. So if that seems like a lot of time and you don't have that kind of time, that's okay. You can start with 15 minutes once a week. The goal is to get started, okay? And once you get started, you're going to start feeling better. It's unknown whether physical activity prevents the onset of depression or just helps to modify the effects, but it's not going to hurt you any. Arranging time for exercise can be difficult for caregivers, and sometimes we see it as a value-added activity, so that means something that you do when everything else is done. But I'm going to encourage you to consider adding it to your to-do list. Okay, this is going to be something you need to prioritize for yourself and in turn for your loved one, because you're taking care of yourself and taking care of them at the same time. So maybe you can ask a friend to give you a walk date each week as a gift, right? Maybe every Wednesday morning you and your friend are going to get out and walk for 15 minutes. Or you maybe even request that your doctor writes you a prescription for walking or joining an exercise class, okay, just to maybe have that tangible representation of how important it is, how it is, kind of a treatment for your own health. So it makes good sense to make time for exercise. All the research says that, and it's easier said than done. But again, you can start small and move your way up. No one's asking you to go to the gym and be a bodybuilder by the end of the month, and that's going to cure your depression, okay? But just starting small, starting where you are, being kind and compassionate towards yourself in this process is going to take you a long, long way in healing. Next, mind and body techniques. So there's a growing body of research showing that our thoughts, our beliefs, and our feelings can have a direct impact on our health and our physical health, and it can impact our mental state. Your mind and body are interrelated. Sometimes we kind of get in this habit of thinking that our mind is separate from our body. Our mind is our body. Okay, our brain is an organ in our body. Our mind, I guess, kind of shoots from that. Depending on where you are on your spiritual journey, you might have different definitions, but I think we all understand what I'm saying. It's not a separate entity. Okay, so mind and body techniques in your routine can alleviate depression. So even if you just do 5 or 10 minutes a day, it can help you. So some to try would be meditation, prayer, deep breathing, acupuncture, yoga, which if you're scared of yoga, please don't be. There's like a gajillion videos online from all ability levels, all experience levels. Some of it's just stretching, some of it's, back bends. I don't do any of that. But there's something for everybody with yoga. Getting a massage, listening to music, creating art, guided imagery, or journaling. So some of these you can go to a practitioner for. Most of them you can just do in your own home at your own time. Okay, it doesn't have to be a huge ordeal, just something to get those mind and body connections created is going to help. So strategies to help yourself. Okay, so a lot of times we can kind of look down on self-help techniques, but I think that they're really important to have a lot of tools in your toolbox of what can help you, especially if you're in between doctor's appointments, or maybe you call a therapist and they say, well, I can put you on the wait list. It'll be 6 months before I can see you. That happens a lot. So I think it's important for us to kind of research and see what works for us outside of a professional, because there are a lot of really good things available to us that aren't going to cost a lot of money. They're not going to take a lot of time, and they really do help. So depressive disorders can make you feel exhausted, helpless, and hopeless. And those negative thoughts and feelings can make some people feel like giving up. So it's important to realize that these negative views are part of the depression, and they may not accurately reflect your situation, right? We're kind of looking through the veil of depression and everything looks worse. So these are some guidelines that were adapted from the National Institute of Mental Health, offering recommendations for dealing with depression. So setting realistic goals in light of depression is probably your best bet. You may not be able to accomplish as much as you're accustomed to when you're feeling well. Okay, just like if you have the flu, no one's going to expect you to go in and do 14 loads of laundry and grocery shopping and all that stuff, right? So you again, exercising self-compassion, knowing that you might not be able to do all these things, but you can start where you are. Okay. So breaking large tasks into small ones, setting some priorities, and do what you can as you can. Okay. Try to be with other people and to confide in someone you know and trust. It's often better than suffering alone. Okay. Sometimes you just need that one person. You don't need a whole group. Okay. You just need one person to hear you. Participate in activities that may make you feel better, such as exercise, going to a movie or a ball game, going to church, or a community event or social event. Okay, sometimes being around people is the last thing you want to do when you're depressed, but it's often the best thing you can do. We are communal beings. We thrive in community. We thrive with other people. Isolation makes everything worse. Expect your mood to improve gradually and not immediately. Feeling better takes time. And I really want to drive this point home to you guys. You might be tired of hearing me saying this, but we cannot stress this enough, because if you're already in a discouraged space, if you're already in a hopeless space and you try something and it doesn't work, it's very easy to just give up, okay? But it takes time. You have to work towards it, okay? Before deciding to make a significant transition, discuss it with others who know you well and can offer another view on your situation. So a significant transition would be like, well, if I just quit my job, divorce my spouse, and move out of the country, my life will be better, right? Maybe, but probably not. You're probably, again, just kind of viewing the world through that veil of depression. And so if you're thinking about making a significant transition in your life, talk with somebody who knows your situation, and can maybe give you a reality check in those situations, okay? And know this, people rarely, quote unquote, snap out of depression, okay? You're not just gonna wake up one day and feel better without some sort of effort or some sort of treatment or routine change, okay? Positive thinking and the practice of new coping patterns will replace the negative thinking that is part of the depression. Okay, so it's easy for people to say, well, just snap out of it or just stop feeling sad, but that doesn't work, right? Simple solutions aren't always the right solutions. So again, exercise self-compassion. Know that this is a process. Say yes to offers of help and engagement by family and friends who you know and trust. So again, if you are depressed, you maybe don't want to be around nobody. You don't want to talk to nobody, but I'm gonna tell you that can be some of the best medicine. Okay, saying yes can be some of the best medicine. Direct assistance in providing care for your loved ones, such as respite care relief, as well as positive feedback from others, positive self-talk, and recreational activities have been linked to lower levels of depression. So you can look for classes and support groups available in your area. And for your health and the health of those around you, take some time to care for yourself, right? We say that all the time to our caregivers. So please do not feel guilty for taking time for yourself, because it will ultimately help everyone, including yourself, that you know. So how do you find a professional in your area? I know the state of Alabama specifically is pretty dry in this department of finding mental health professionals that don't have a waiting list, but they're still out there. So a psychiatrist is a medical doctor, and they specialize in the diagnosis, treatment, and prevention of mental illnesses, including substance abuse and addiction. You can go to the American Psychiatric Association at psych.org, and they have free information on depression and referrals to psychiatrists in your area. Okay. You can go see a psychologist, which has a PhD. They're licensed to practice psychotherapy, and they have special training and psychological testing. Okay. You can go to the American Psychological Association website at apa.org. Visiting their website, you can find more information about depression, and they have a toll-free number that you can call to be referred to a psychologist in your area. So not everyone is going to need to see a psychologist or a psychiatrist. Some of you can be okay talking to a licensed clinical social worker, okay? They are licensed to practice psychotherapy, and they have special training in addressing the person in environment, okay? They have specialized training in human behavior, family behavior, psychology, and problem solving. So a social worker typically won't be able to prescribe medication, but they will definitely be able to help you with the talk therapy side of things, strategies, help you develop your toolbox on what helps you, and they can refer you out to people if they feel like medication is something that you need, okay? And if you go to National Social Work website at naswdc.org, there is free information on depression and referrals to social workers in your area. I personally am biased, I guess, for social workers because I am a social worker. So you can always call me too. I can't give you any prescriptions, but I'll definitely listen to you and kind of help you cope through some of those things. And finding a professional in your area. So here's some other organizations and links. So Medicare at medicare.gov, or you can call 1-800-MEDICARE and request a copy of Medicare and your mental health benefits. So if you don't have insurance, or there's not a sliding scale therapist in your area that you know of, Medicare is an option to help you pay for some of these services. So it never hurts to see if you qualify. There's also the National Institute of Mental Health. They provide free information on depression as well, and other mental illnesses in English and Spanish. Sometimes just hearing about what is depression, what are mental illnesses, can kind of guide you in what type of treatment that you're going to seek. So it's good to be as informed as possible. And then the National Institute for Complementary and Integrative Health, they also have some resources that you might find useful at nccam.nih.gov. And then lastly, we have some phone numbers for you. So Wings Across Alabama is a warm line for non-crisis peer support. So a hotline would be, I'm in crisis. A warm line is, I'm fitting to be in crisis, so please talk to me, okay? There's the Veterans Crisis Line. There's, of course, the 988 Suicide and Crisis Lifeline. You can contact NAMI. They have a helpline, and there are 1-800 numbers for everybody in the state of Alabama and beyond for advocacy, autism assistance, developmental disability assistance, mental illness, peer support, and substance use. So I'll leave this up here in case anyone's jotting it down. And I'll stop sharing my screen here. So that was a lot of information. I hope it was useful. And I know sometimes when we think about being suicidal, we think about how the movies portray it, right? It's often the desperate man on the top of a building who's being coaxed back, to not fling himself to his demise, or the person with a bottle of pills and they're, making a big show about it. But often these symptoms are very silent. They're very intimate, they're interpersonal, they're in your own space. Nobody really knows about it. So suicidal ideation, depression, you might be the only one who knows you're feeling it, right? A lot of times, especially if we're caregiving for other people, it's always about their needs, what they have to have done, how they're feeling, how they're getting along. And so it's easy for us to gaslight ourselves or act like it's not as big of a deal as it is. So I hope that this information has encouraged you to take a good look at yourself and really see how you can care for yourself better, okay? Because the last thing that we want is for you to give up hope and feel like you can't do it anymore and take your own life. And as you saw in my statistics, it is very, very prevalent and very common amongst your peers. So I just want to implore you, please, 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 if you need to reach out to somebody, anybody, do it, right? It's a lot better than suffering alone. So before I start asking if anyone wants to share or have any questions, I just want to ask that if you have yet to do so, please put your email in the chat so I can take attendance. And I will go ahead and stop recording now so that we can have an offline discussion.